Hi, good morning or afternoon, depending on when this has been shown. My name's Rob Pinate. I'm a consultant nurse in the emergency department at University College London Hospital. And we have a team of ACPs here. We have both credentialed and trainee ACPs, which is great and has been developed over the last few years. So I think in terms of COVID and how we've kind of maintained the morale within the team, I think there's a few things that we've tried to do, and hopefully the ACPs and trainee ACPs would agree with me. I think one of the key things for us was around consistency and knowing that our trainees and ACPs are a consistent part of our workforce and how they could become part of that consistent provision of care for our patients during the COVID, particularly during the heights of the waves in the COVID, where we had a lot of medical staff being drafted in from other areas that weren't familiar with the department, but obviously our ACPs were. We did our best to ensure that we kept some of our group meetings together and that we met and actually talked to each other and tried to provide support to each other then. And also I think for me, there was something really important about, at one point actually ED was not the problem and it was intensive care. And as a team, we en masse provided support and cover, clinical cover in the intensive care unit here at UCLH. It was only for a short period of time in January, February of this year, but actually it brought a lot of sense of well-being in as much that we felt that we could give something back to the organisation and use our expertise in a very different environment, and it was really valued by our intensive care colleagues. So I think that's really helped in terms of creating that kind of team ethos, because we did it all together, and we've brought some of that stuff back to ED. So yeah, I think we've weathered the storm. I think we're all a bit nervous about the winter coming up, to be perfectly honest. But we continue to try and do our best to keep together as a team.